Well, hello, it's Bruce Williams, and it's Friday, so it's time for another Gross Path Challenge. Gross Path Challenge number 17 takes us back to the 2015 Descriptive Pathology course given in the Western College of Veterinary Medicine in Saskatoon, Saskatchewan. I want to thank all the friends and colleagues who provided me their images over the years, and here's a list of those that you will see in the next 5 descriptive challenges, which will come from test number 3 given at that course. Okay, let's start the weekend by getting on our pens, our papers, and give yourself 60 to 90 seconds. 60 seconds for this particular one. It's very straightforward. This is tissue from a kitten. All I want is a good morphologic diagnosis. Okay, time's up. We're back. This is a condition that is well known in ruminants who ingest a particular type of plant, Veratrum californicum, in a small window between 12 to 16 days of gestation. But it is also a congenital lesion in just about every other species of animals, all the way up to people. The word that I'm looking for is either cyclopia or synophthalmus, which is probably more proper because this animal actually has 2 fused eyes in a single orbit. But I'll take cyclopia for full credit. This in animals other than those eating Veratrum californicum is usually due to a defect in the gene product of the sonic hedgehog gene, which is responsible for the cleavage of structures at the cranial end of the embryo. The eye is the most obvious thing. If we were to remove the brain, we would see that it had a single lobe of the cerebrum, not 2. That condition would be called holoprosencephaly. There's no nose here. Usually, if there are any remnants of a nose at all, they may be up here on top of the eye. So not a common defect, but certainly a classic defect. And synophthalmia cyclopia or synophthalmus is the word that I am looking for. Okay, let's move on. Slide number 2 is tissue from a snake. I'd like a morphologic diagnosis and a cause, please. Okay, time's up. It's a classic disease. If you're a snake fancier, you may call this mouth rot. The name of the disease and the morphologic diagnosis are actually the same thing. This is multifocal to coalescing necrotizing stomatitis. And the medical term for this disease, the medical name for this disease, is necrotic stomatitis in snakes. Usually caused by gram-negative organisms, or at least that's what gets cultured out of them. And the classic causes of this condition is Eromonas hydrophila or Pseudomonas aeruginosa. Often has to do with husbandry practices in snakes and can be a real problem, causing them to go off their food and significant gastric and intestinal dysbiosis, and maybe the end of the snake. Slide number 3 is a rat. All I want is a morphologic diagnosis. Okay, we're back. It's a rat. Most common mammary tumor in the rat, most common tumor in the rat, just about anywhere on the rat's body, is going to be a mammary fibroadenoma. Make sure that you write down mammary as well as fibroadenoma. These are benign tumors. Most of the mammary tumors in mice are due to retroviral infection, the mouse mammary tumor virus, which is present in the genome of just about every mouse out there. Rats don't have that. Rats get benign fibroadenomas histologically. They're a varying mix of fibrous connective tissue, a little bit of myoepithelium, and often functioning secretory material. Okay, so the glands that you see may have large, clear fat droplets within them. Okay, moving on to slide number 4. This is tissue from a rabbit. How about a morphologic diagnosis and a cause? Okay, well, hopefully you've been looking at the rabbit videos that I'm currently in the process of recording. This is just absolutely a classic disease of rabbits. The head of the rabbit is going to the right. Here's the unopened rib cage, but the abdomen has been open. This is a diffuse severe fibrinosuppurative peritonitis, and the cause is Pasteurella multocida, the bad actor in rabbit medicine. There is one other possibility here, and that would be Staph aureus. I really like this one for Pasteurella, but Staph aureus can really mimic what goes on with Pasteurella multocida. So if you wrote down Staph aureus, and I'll give you credit as well, but it's just this sort of creamy, thick, white, tenacious exudate that's gumming everything up is very classic for Pasteurella multocida, the cause of snuffles in rabbits. Slide number 5. We're moving right along, and this is tissue from an ox. I'd like a morphologic diagnosis and 3 possible causes. Okay. Morphologic diagnosis. This one's a little tricky, okay, because we're looking at that. We have very pink tissue, somewhat nodular, a lot of fibrous connective tissue surrounding it. And a lot of people have trouble identifying this as liver. Remember, when we look at cirrhosis of the liver in small animals, especially dog, it tends to be very, very nodular, a lot of small nodules, okay? Well, in ruminants, you tend to have a lot less of the macronodular regeneration, a lot more of the scarring, and the whole thing will be riddled with fibrous connective tissue and will contract. The entire organ sort of gets smaller. Okay, so a morphologic diagnosis for this will be diffuse hepatocellular necrosis and loss with post-necrotic scarring. And you can probably go a number of different ways as long as within your morphologic diagnosis you talk about the necrosis of the hepatocytes, the loss of hepatocytes, and some form of fibrosis. Okay, and then what I would do is at the end, just to make sure that everybody knows that I know what I'm talking about, I'm going to put cirrhosis in parentheses. I think cirrhosis is a very terrible morphologic diagnosis, because if you ask 10 different pathologists what cirrhosis is, they're going to give you 10 different answers. The diagnostic pathologists are going to vary markedly from the toxicologic pathologists. So I like to get the concept of hepatocellular necrosis, which goes on at a low rate for a long time, and loss, because that's why these animals eventually, if they're not overcome by other events, will go into hepatic failure, and the fibrosis, which is often the major characteristic of what you see in large animals. Name 3 possible causes. Well, there's so many different plants. As long as you know 3 of them, that will be fine. Senecio, Crotalaria, Pithomyces are all good ones. If you want to mention toxins instead, aflatoxin, pyrrolizidine alkaloid, any of that. But I would walk into any certification exam knowing 3 plants that will do this, and then some major categories of toxins. If you wanted to, you could probably ask, name another affected organ, and I would probably point at the skin. Something like this will result in photosensitization. So a lot of ways that you could tie in cirrhosis into a testing situation. Okay. Slide number 6. Well, I hope that everybody has been watching the Wednesday slide conference, because this was seen this year in conference number 5, case number 4, just 2 weeks ago. So this is tissue from a rat, and all I want is a morphologic diagnosis. Okay, we're back. It's a classic tumor in a classic spot underneath the ear of a rat. This tumor is ulcerated. This is one I certainly would not give you any credit for mammary fibroadenoma, not in this spot right here. This is a classic spot for a Zimbel's gland tumor. I don't usually, most of them, the vast majority of them are benign. They never tend to metastasize. They get big, they get ulcerated. This particular gland is a gland that's a combination of sebaceous gland and squamous epithelium. Either of those, when they get ulcerated, tend to get really ugly looking. And so I just call them all Zimbel's gland tumors. Rarely you'll get papillomas of the Zimbel's gland. Maybe that's about 2% of all the tumors. So Zimbel's gland tumor, and drive on. Slide number 7 is tissue from a dog. I want 2 morphologic diagnoses for this case. Okay, time's up. I think most people recognize this. They get a little puzzled as to what to write down when they see this particular lesion. Okay, it is tissue from a dog, and you can see that the ligamentous arteriosus is very prominent. It is stretched across the esophagus. There is some bulging of the esophagus in the proximal area, so the head is going to be up here. Okay, it's a classic lesion, and I prefer the term vascular ring anomaly. Okay, some people call it a persistent right aortic arch. That's perfectly correct, but then you sort of have to understand the mechanism of how this works. Normally the aorta comes in from the left. Okay, 2 aortic arches, one disappears, and it comes in from the left, and everything is fine. When the aorta comes in from the right, it pulls all the major vessels this way, and it stretches the ligamentum arteriosum, which used to be the patent ductus arteriosus, but at birth it will shut down and become a band of fibrous connective tissue. This one doesn't even look like it's shut down very well, but it stretches it across the esophagus very tight, and it blocks the esophagus, giving rise to the second morphologic diagnosis, which is megaesophagus. In these cases, the esophagus distal to the compression by the ligamentum aortum is perfectly fine. The vascular ring anomaly is caused by the aorta, the ligamentum arteriosum, and the base of the pulmonary artery, which forms a constriction that normally does not happen if the aorta comes in from the left, as it is supposed to. So if you wrote down either vascular ring anomaly, my preferred diagnosis, because I don't have to go through that long explanation, or persistent right aortic arch, full credit for either one. And the second one is going to be megaesophagus. These megaesophagus are megaesophagi, maybe that's a plural. They are classic because it stops right at the base of the heart. If you have megaesophagus that goes, all the way down into the stomach, well, then you're looking at probably an acquired form, and there are a zillion different causes, everything from lead toxicity to various neurogenic abnormalities, polymyositis, some forms of polymyositis, and a lot of idiopathic causes. Okay, well, that was great. Slide number 8 is tissue from a sheep. I would like a morphologic diagnosis and 2 possible causes. Okay, time's up. We're looking at the dental pad and the hard palate. So we're looking up into the maxilla of the sheep. The morphologic diagnosis is multifocal to coalescing ulcerative stomatitis, chylitis, and palatitis. If you didn't break out stomatitis and palatitis, you just said stomatitis, that's fine. Realize that there are ulcers here. We saw the nose, there are probably some ulcers there. But you said necrotizing stomatitis, chylitis, and palatitis, full credit. If you said hemorrhagic, I'm going to take away a point, because remember, we'll say over and over, when you see hemorrhage, think about necrosis, and you can even see that a lot of this tissue is missing. So it's necrotizing or ulcerative. I don't distinguish between ulcerative and necrotizing because all an ulcer is necrosis of a mucosal surface. So any of those are good. And I want two possible causes. Okay, first one I'm going to think about whenever I see hemorrhage in and around, necrosis in and around the mouth, is going to be ovine orbivirus or blue tongue. Okay, that's a great one. A second possible cause is going to be ovine morbillivirus or Peste du petit ruminant, and I hope I said that correctly. Peste du petit ruminant is a disease that really whacks these animals. It combines the lesions of distemper in the dog and rinderpest in cattle, and it affects both the respiratory and digestive system, causing ulceration throughout the GI tract. It's usually sparing the abomasum, but causes a lot of problems. I suppose a remote possibility would be something like ovine pestivirus. We tend to think of pestivirus as causing hairy shaker syndrome, but it can cause a diarrheal disease with ulceration. But I think that the ovine orbivirus and ovine morbillivirus would be top of my list. Okay, here is slide number 9, and this is tissue from a goat. I'd like a morphologic diagnosis, the cause, and name 2 other possible lesions in this animal. Give yourself 90 seconds for this somewhat convoluted question. Okay, let's go. We're looking at a section of lung. The lung is diffusely inflated, okay, has not collapsed. If we were to see it from the side, I bet we would see some nice rib impressions. Okay, so some people might say it's consolidated, however you want to put that. But the morphologic diagnosis that I'm going to put on this is going to be interstitial pneumonia. Okay, those are the ones where they're not anaeroventral, they're not bronchopneumonia, the lung is diffusely affected. Okay, but remember, interstitial pneumonia is not a process, it's simply a localization. So, multifocal coalescing or diffuse lymphocytic interstitial pneumonia. If you want to call it lymphohistiocytic, that would be acceptable as well. Okay, the cause of this is caprine lentivirus. It is also known as caprine arthritis and encephalitis virus, or CAE virus. Causes a classic lentiviral pneumonia. So histologically, what you would see is diffuse infiltration by lymphocytes and histiocytes and the formation of lymphoid nodules. 2 other possible lesions in this animal. Well, if you know that this is CAE virus, I would probably write down arthritis and encephalitis. The encephalitis is generally restricted to young animals. Older animals will develop mastitis and arthritis. So any of those 3 would be fine. Okay, here is our last slide for today. This is tissue from a horse. A classic lesion. I want a morphologic diagnosis and a cause. Okay, time's up. Morphologic diagnosis. Well, this is the classic dish rag liver, which is the result of massive hepatic necrosis, and that's a morphologic diagnosis: diffuse massive hepatic necrosis. Massive doesn't mean that there's severe necrosis. Obviously severe necrosis. Massive means that the necrosis affects all sections of the lobule, including the centrolobular, midzonal, and periportal hepatocytes. We've lost all the hepatocytes. We've had tremendous stromal collapse. All that's left is the fibrous connective tissue and the bile ducts. So the hepatocytes, those big cells that give body to the liver, are all gone. So it just sort of flops around in your hand. This animal probably had severe neurologic disease, was head pressing, hyperammonemic, was blind, Okay, just massive hepatic necrosis and failure. So the cause. Well, I hope you're keeping up with the literature because it keeps changing. The classic cause, I think that I'll still go and give credit for this, is any xenobiologic administration, usually within the last 140 days. There's a tremendous amount of controversy in the literature. About 3 years ago, a flavivirus was identified as a cause of this, but then that was discounted, and now there is a new virus which has been identified as a parvovirus by a group in multiple different organizations, and a lot of work has been done. One of the authors on that is Dr. John Cullen, who I think is really, really good. And if he endorses this, it's good enough for me. This equine parvovirus is a copy parvovirus, but it shares less than 50% of the protein identities with the other copy parvoviruses, so maybe there's some reclassification in the future. So I think that you need to know about Tyler's disease or serum sickness that is often associated with the administration of previous administration of biologicals. It's often seen in animals that they harvest serum from, and right now it is a copy parvovirus. Okay, well that's it. I hope you did fantastic on this. I hope you have a great weekend. Look forward to another Growth Path Challenge from 2015 next Friday, and have a fantastic day.